If you're getting ready for spine surgery, there's a lot you can do to make sure you have the best possible outcome. I'm Dr. Richard Hurley, and in this video, I'm going to walk you through exactly what you need to know before surgery to help with your recovery, reduce your risks, and get back to doing the things you love. So let's dive in. First up, prehabilitation or prehab. Think of it as training for surgery. The stronger and more flexible your core is before surgery, the easier your recovery will be. Physical therapy can help improve your mobility and build strength, setting you up for success post-surgery. I highly recommend the Back Doctor app, created by a spine surgeon, Dr. Watkins in Los Angeles. It's a great tool that provides safe and effective exercises for a variety of spinal conditions. If you're wondering what exercises you can do before surgery, this app is a must-have. And don't forget, consistency is key. Even 15 minutes a day can make a huge difference in your recovery process. Non-surgical treatments and injections. Before considering surgery, it's essential to explore all appropriate non-surgical treatments. These treatments may include over-the-counter or even prescription medications for pain relief, physical therapy, or other methods like steroid injections. Steroid injections can help not only in confirming the diagnosis, but also relieve pain and improve function temporarily. Don't forget that the mind is also responsible for interpreting pain signals. I'm currently involved in research looking at instituting mindfulness techniques on a daily basis to help with alleviating pain and improving symptoms associated with back pain. Additionally, studies have found a frequent coexistence of depression in patients with low back pain, and treating underlying depression with cognitive behavioral therapy in conjunction with antidepressants can be effective in treating and alleviating low back pain. Finally, stay hydrated. Remember that the discs in your back are composed of water, and therefore staying hydrated can aid in maintaining your overall disc health. Understanding types of injections. Understanding the role for injections and how they work can be beneficial in managing symptoms and possibly delaying the need for surgery. When I send a patient to receive an injection from their pain management physician, I will frequently ask for a very specific type of injection, or I will speak directly to the pain management physician. And I do this for several reasons. First, I want to make sure we are arriving at the correct diagnosis. Sometimes an injection is performed in a diagnostic fashion to confirm the suspected diagnosis. Second, I want to make sure that we are avoiding confusion and ambiguity, because we might be requesting a very specific type of injection, one required by insurance companies to help get surgery approved. For instance, a fluoroscopic guided sacroiliac joint injection is a great example of a time when we ask pain management physicians to perform a very specific injection. Third, I routinely ask patients to keep a journal around the time of their injections, because it's important to document what your pre and post-procedure pain score is so we can discuss the efficacy of the injection. Write down the type of injection you are receiving, because there is a significant difference between medial branch blocks, for instance, and epidural steroid injections. Keep a pain journal. Writing down how you feel before and after an injection really helps us track what's working. Nutrition and weight management. Your diet and weight play a huge role in your surgery outcome. Good nutrition helps with wound healing and reduces infectious risks. And if you're overweight, shedding a few pounds can take stress off your spine. A recent study even showed that patients using GLP-1 medications had better results after spine surgery. If you're considering weight loss options, talk to your doctor about what might be best for you. Focus on a high-protein diet and plenty of vitamins and minerals to support your body through that recovery process. And don't forget, hydration is also crucial. Drink plenty of water. For more information, I recommend the following website as a resource: medical clearance and lifestyle changes. Before surgery, you might need medical clearance from your primary care doctor. Medical clearance is a comprehensive assessment performed by a physician with or without the aid of a specialist, such as a cardiologist, for instance, if you have a history of heart disease, to ensure that you are in optimal health prior to undergoing surgery. It typically involves evaluating your medical history, performing a thorough physical examination, and can include several diagnostic tests to evaluate your readiness for surgery. This is a critical consideration before surgery, especially for optimizing medical outcomes. Also, if you smoke, this is the time to quit. Studies show that stopping 30 days before surgery dramatically improves your healing. Smoking restricts blood flow, which can slow recovery and increase complications. And if you're using narcotics for pain, try to taper off before surgery so we can manage your post-op pain more effectively. This will help you avoid complications with anesthesia and post-op pain management. setting goals for recovery. Goals of surgery include restoring function and promoting a worthwhile, meaningful long-term recovery. Surgery is about getting you back to doing what you love. You may have limitations briefly after surgery, but we need to plan ahead at the time of surgery and give you goals to achieve after surgery. Maybe it's playing golf or running or just being more active with your family. Having a clear goal keeps you motivated throughout recovery. Setting realistic milestones will help keep you focused and optimistic about your progress. Asking questions and getting second opinions. One of the best things you can do is ask your surgeon questions. Jot down your questions in your phone so you don't forget. The more you know about your procedure, the more confident and prepared you'll feel. Make sure to ask about post-surgical care, physical therapy, and what to expect in the first few weeks after surgery. And don't be afraid about getting a second or even a third opinion. If a surgeon isn't comfortable with you seeking a second opinion, you might consider that a red flag. I welcome the additional insight and perspective in my own practice when my colleagues provide another opinion. I personally sought multiple opinions for my own medical condition years ago, and it gave me several valuable viewpoints to consider. Surgery is a big decision, and you should feel 100% comfortable with your choice and your surgeon. Exploring all your options ensures you're making the best decision for your health. Preparing for spine surgery can feel overwhelming, but taking these steps will set you up for the best possible outcome. Remember, the work you put in before surgery will pay off in your recovery. If you found this video helpful, hit the like button, subscribe for more spine health tips, and leave a comment if you have any questions. I'd love to help.